And a very good morning to you guys. Welcome back, of course. This is Rhema Brekky, and it is that time of the month, of course. We are joined by our resident medico, Dr. Clara Chu, is in the chair. Welcome back. And how's the shoulder, by the way?
Yeah, really good, thanks. Thanks for asking about my shoulder. I had a minor shoulder surgery done. It was a lot simpler than what we anticipated, so I'm very, very thankful.
Nice work. Okay, look, so a big month, this month of June for health especially, and obviously it is Bowel Cancer Awareness Month. That is a huge topic in Australia for sure. And so I thought we would jump into that today and talk about some of the intricacies of bowel cancer. So Clara, what is bowel cancer?
So bowel cancer, also known as colorectal cancer, develops from the inner lining of the bowel. So it's usually started off with like little growths in the bowel called polyps. So people may have heard of that. And then they may become invasive cancer if they go on to become undetected. So depending on where the cancer begins, the bowel cancer may be called colon cancer or rectal cancer.
So we hear this, kind of this blanket phrase of bowel cancer, but are there different types?
Yeah, so there are different types of bowel cancers. So, as doctors, we like to classify things. So we'll, they're classified in different ways. So, for example, we can classify them according to the location of the cancer. So that's pretty intuitive. Or we can classify them by the types of cells that causes the cancer. So that's a little bit more tricky. Now, I like keeping things simple. So let's talk about them by the location of the cancer. So obviously, if it happens in the small bowel, it's called small bowel cancer. And if it happens in the large bowel, it's called colon cancer. Cancer in the back passage is called rectal cancer. And then cancer in the bowel opening is called anal cancer. So, there's also a sort of, cell or tissue type classification, but that's probably more important for, the doctor who's treating it than for the average person.
Sure. Now, who can get bowel cancer?
So it most commonly happens in people over the age of 50, but it can occur in any age. So I've had at least 2 patients now who've been diagnosed with bowel cancer before the age of 40.
And how does it start in the body?
So as I mentioned earlier, it may begin with polyps. So as people get older, little lumps called polyps may grow inside the colon or the rectum, and they can become cancerous. So a polyp looks like a little spot on the bowel lining or like cherries on a stalk. So not all polyps will become cancer. Many, in fact, are benign. But if polyps are removed, then the risk of bowel cancer is reduced.
Sure. So it's very important to have the screening, obviously, to get those polyps checked out for sure.
Yeah.
What are the most common symptoms of bowel cancer? Because this is obviously something that people will want to be keeping a bit of an eye on for their body.
Yep, sure. So bowel cancer can develop with no symptoms. So we talked about, you mentioned screening just now. So it's super important to participate in the screening. And we'll talk about that a little bit more later. But some of the symptoms may include blood in your poo, blood on the toilet paper or in the toilet bowl, a change with your bowel habits. So sometimes it can become constipation or diarrhea. Feeling like you need to open your bowels more often, or the feeling of incomplete emptying is another common one. Feeling full or bloated in your tummy, or a strange sensation in your rectum, often during a bowel movement. People sometimes can get a change in the appearance of what their stool looks like. They can get pain in the anus or in the rectum. They can feel a lump in the anus of the rectum, or there can be, overt blockage in the bowel. So they're kind of like the more common things. There are sort of like less specific symptoms like unexplained tiredness, anemia, weight loss, tummy pains or cramps or bloating. But, those kind of other symptoms can happen with like all sorts of illnesses. So,
Sure. So again, super important to speak to your doctor.
Yeah, absolutely. Just because you've got some of those symptoms there,
Yep.
It doesn't mean that you necessarily have it, but it's definitely a sign that you should go and get things checked out.
Absolutely. This is Rhema Brekky, of course, and for the month of June, we're talking about bowel cancer awareness, joined by our resident medico, Dr. Clara Chu. Stick around. More with Dr. Clara right after this. And welcome back, of course. This is Rhema Brekky, joined by our resident medico, Dr. Clara Chu. And today, of course, and for the whole month, we are talking about bowel cancer awareness, being the month of June. And Dr. Clara, continuing on from a little bit earlier, now, what are some of the factors that can increase bowel cancer risk?
So both men and women are at risk of developing bowel cancer. And the risk is greater if you're over the age of 50. As your risk increases with age. If you have an inflammatory bowel condition like Crohn's disease or ulcerative colitis, those who have those conditions will know what I'm talking about. If you've had any types of polyps in the bowel in the past, or any previous types of bowel cancer. Now, and obviously, you know, family history does play a role here. For bowel cancer, and there are certain familial conditions that can actually put people at a much higher risk of having bowel cancer. And then there's also, you know, random gene mutations and things like that. Now, these are risk factors that can't be easily changed, right? You know, you can't change whether some of these things, you've got the genes for it or it's already happened or your age. But then there are other risk factors which we can have control over. So, you know, excess body fat and physical inactivity is one risk factor. A high intake of particular foods such as red and processed meat, having low levels of vitamin D, drinking excessive alcohol, smoking, type 2 diabetes, and remembering that type 2 diabetes is a condition that's caused by the lifestyle choices we make. So, you know, there's a few things there that we can modify.
Sure. I guess now going on from that, are there ways that we can decrease the risk of getting bowel cancer?
Yeah, definitely. So I mentioned just now that there are some risk factors that are not in our control, but then there are so many things that are. So changing some of these can help decrease your risk of developing bowel cancer. So there's a few of them, so we'll get started. So maintaining a healthy body weight. So being above a healthy body weight is linked to various cancers, not just bowel cancer. So reducing your risk by keeping your body weight within a healthy range and avoiding weight gain. I understand that is difficult, but it is sort of, you know, what we're aiming for. Being physically active. So being physically active helps to reduce the risk of bowel cancer. You know, it's good for your bowels as it helps to remove the waste and you know, and it also helps to prevent weight gain. So the recommendation is, you know, to get active for at least 30 minutes each day by doing activities like running, swimming, even housework. Just avoid sitting for long periods of time. The third one is eating less processed meats and red meats. So processed meats and red meats have been shown to be a carcinogen. They can increase your risk of bowel cancer. So the current recommendation is to eat no more than 1 serve of lean red meat per day, or two serves 3 to 4 times per week. So, you know, really need to minimize that. And red meat includes beef, lamb, and pork. Now, cutting out processed meats or keeping them to a minimum is another important one. Now, I know they're super yummy because we're talking about things like ham, salami, bacon,
chorizo, sausages.
Absolutely. Man. All that stuff, right? But unfortunately, they're not great for us.
Right.
So, you know, really, you can add to that list your Frankfurts, your Cabanossis, your Kranskis, your Devon. We really need to, you know, keep them to a minimum. Call them a sometime food, right? Not kind of like an everyday food.
Yeah, I mean, they're super high in salt too, a lot of those things, aren't they?
Yeah, that's right.
Yeah.
You know, the fourth one here is drinking less alcohol. So alcohol is a risk factor for some cancers, and you may not realize that even drinking a small amount of alcohol can increase your risk. So the national guideline regarding drinking is no more than 10 standard drinks a week and no more than 4 standard drinks on any one day. Another one, eating whole grains, dietary fiber, and dairy foods. So a diet that's high in fiber, that includes lots of whole grain cereal, can help make sure that our digestive system stays healthy and that we maintain a healthy body weight. A simple way to do this and to help with maintaining a good weight is to follow the healthy plate as recommended by Dr. Joanna McMillan. I may have brought up her plate before at during one of our previous sessions. So in every meal, eat half a plate of fruit or vegetables, just under a quarter of a plate of lean, healthy proteins, just under a quarter of a plate of whole grains and carby vegetables, and then finally a dash of healthy fats in the form of extra virgin olive oil, avocado, nuts, and seeds. And if you want to check out a visual version of this plate, you can Google Dr. Joanna plate, and that will take you straight to the website where you can see exactly what I'm talking about.
Oh, nice. That will be helpful.
Yeah. Just 2 more to go, so bear with me. Quit smoking. If you're a smoker, more likely to develop bowel cancer. So quitting smoking is crucial. And then the last one is getting screened regularly. So if you're aged between 50 and 74, you can take part in the National Bowel Cancer Screening Program. So the government has this all automated, and you will automatically receive a free test every 2 years to do at home. Simple and easy to do, not too icky. I know that some people kind of feel like it's just a bit gross, but the test can help identify early signs of bowel cancer. And if we find it early, more than 90% of cases can be successfully treated.
Yeah, absolutely. I've done a couple myself at home, and it was fine. No problem at all. So, get onto it. You need to keep that sort of thing going as well.
Yeah.
Now here's the thing, though. What should you do if you do happen to get a positive bowel cancer screening test?
Yeah, so if you should get a positive bowel cancer screening test result, go and visit your GP. Now, normally, I think on that form, you have to nominate a GP anyway.
Sure.
So usually your GP is kind of like ahead of the game in knowing that, a test results come back positive. Now, your GP will refer you to a gastroenterologist or a surgeon for a colonoscopy, which is where a small camera is attached to the end of a long, flexible tube, and the specialist can take a look inside of your bowels under sedation. This allows them to look for a cause for the blood in your stool and also take a sample of anything that doesn't look quite right, like polyps and stuff like that.
Sure. What are the current treatments and the prognosis for a bowel cancer diagnosis these days?
Yeah, so the current treatment for bowel cancer usually involves surgically removing the cancer from the bowel and also some of the local lymph nodes to just check for spread and things like that. Now, depending on how advanced the cancer is, some patients may be offered chemotherapy. For rectal cancer, radiotherapy is an additional possible option. Treatment option. The reason why rectal cancer gets, also can have radiotherapy is because right down low in the rectum, there's not a lot of wriggle room for the bowel to move around.
Right.
Whereas the large bowel is attached by things that are quite mobile, so you can't guarantee that the radiation will hit the right spot every time.
Right.
But in the rectum, where the space is a bit tight, they can actually do that.
Yeah, wow.
So prognosis depends on the stage of cancer at diagnosis. So, for example, the 5-year relative survival rate for early bowel cancer is as high as 98.6%.
Wow.
Which are really, really good odds. So what this means is that at 5 years after diagnosis, roughly 98.6% of people are still alive. So, if it's picked up early, what we're talking about is almost everyone who's picked up early is still alive at 5 years.
Yeah, that's amazing. So really, being on top of the game as far as doing your screenings every couple of years is a massive deal, isn't it? It shouldn't be like the old days where, people just put things off and put things off and put things off, and then all of a sudden, they discover that they've got massive problems internally with cancer, whereas if they would have got onto it early, they could have, lived a long, healthy life.
Yeah,
so to speak.
Absolutely. Yeah.
So, Now, where can people actually get support from?
Yeah, look, so most hospitals have a very supportive cancer care team for patients with most types of cancers. And if anyone is looking for resources outside of the medical system, there are a few websites. So bowelcanceraustralia.org and the Cancer Council of New South Wales are two of the really good sites to go to for additional information. But I've found in my experience that, the system for looking after patients with these kind of diagnoses is so good. It just kind of, runs like clockwork. They all know what they're doing. Sure.
Yeah. So again, guys, if you're listening in this morning, make sure that if you do happen to get your screening kits in the mail, get onto that ASAP, because it literally can save your life.
Yep.
When you think about it. So we want to make sure that we keep on top of that. God's given us one body. We want to have it for as long as we possibly can, in as good a condition as we possibly can. There's a lot of stuff to do here on planet Earth. So make sure that we, again, for the month of June, it is Bowel Cancer Awareness Month. We want to make sure that we're keeping on top of the game there. Dr. Clara, as always, Massive pleasure to have you in the studios with us this morning. Thank you so much. And this is Rhema Brekky, of course. Stay with us. Some more great stuff right after this.